Hello and welcome to the Lady Parts Doctor podcast. I'm so excited to have another guest in our Convo series. So I'm going to give a brief introduction for our conversation today. Our special guest today is Dr. Tieya Qualls. She is a physical therapist with expertise in a lot of different areas. And I'm just going to give some of her bio and then I'll toss it to her so she can give you a little more information. But she has a physical therapy practice. It is Quality Touch Physical Therapy and Wellness. She is the founder of Quality Touch Physical Therapy and Wellness, and she serves the DMV area, DC, Maryland, and Virginia. She's a licensed physical therapist, but she also has an additional certification in pelvic health, which, you know, we're going to go on to talk about this and the importance of this, but it's so necessary, so important, so helpful for many of us. She earned her BS in biology from Hampton University, HU. I'm not going to say the real HU because I didn't go to an HBCU and I don't want to get involved in that. But after that, she got a master's and a doctoral degree in physical therapy from Howard. So you did both HUs. So I guess I could say the real HU for you for both of them. And she has been in practice and had a career over 16 years. So she knows what she's talking about. She also, in addition to all of this, is a doula. So we've been also talking about the importance of having additional support in childbirth and pregnancy and postpartum. So she's trained as a birth doula. She provides education, emotional and physical support for pregnant people and postpartum people. So I am very, very honored and thankful to have you joining us today.
Yes, thank you for having me. I'm excited to do this with you. So, yep, let's get to it.
Yeah, is there anything that you want to add for the bio?
I think you covered it pretty well. So I would say the biggest thing that I would mainly add is that I provide home services. So I travel to people's homes, providing services in home, but we also offer services in our clinic locations, which are in Alexandria, Virginia, as well as Rockville, Maryland. And for those that would like a virtual experience, we also offer telehealth services as well. And you can follow us at Quality Touch PT across all social media handles.
Whoop, whoop. And we'll remind you of that at the end of the podcast today, just in case you forgot or you didn't have your pen or pencil ready, or you're not convinced, but I know that you're already convinced. So first, I want to just have you explain a little bit to everyone, like, what is a physical therapist? Because I think even going into medical school, you know, when I was in medical school, we had other people. I went to Temple, and there were people in physical therapy, and we didn't always have a great understanding of what a physical therapist does. And I think that translates into residency and after. So what does a physical therapist do?
Okay, so simply put, because it's a whole long definition I can give, but simply put, physical therapists are basically rehabilitation specialists. So we help to return someone to prior function. And what that means is, say, for instance, if you had a car accident, you broke a bone, you had a muscle strain, you couldn't stand or walk the way you normally would, we would be the individuals that would help to improve your ability to do the things you were doing prior to that. Mm-hmm. Now, in addition to doing like rehabilitation, we also will work with people doing what we call prehab, so preventative maintenance or preventative management.
That's important.
Yes, very much. So for instance, someone who just wants to prevent an injury, like someone who plays sports or does something repetitively, maybe at their job or even in just their leisure activities, we may work with them on, you know, how to improve their posture when they are golfing or how they can run more efficiently, things like that. So those are just simple definitions of what we do, basically improving your function in your day-to-day life.
Awesome. So we are talking on the Lady Parts Doctor podcast, but really she's explaining that everybody has an opportunity and probably a reason, at least at some point, to get physical therapy, whether you have lady parts or not. And she provides care to everybody, not just those with lady parts. Right.
I do, definitely. We do pelvic floor therapy with my company, which we'll get into a little bit later. So that can involve all people, anyone with a pelvis, males, females, transgender individuals, any non-binary, so forth and so on. So basically anyone with a pelvis can benefit from that.
And I love that you mentioned that, because we had a conversation about this and I was like, man, I didn't even think about like pelvic floor physical therapy for people who identify as men. And I'm like, obviously they have a pelvis, they have a pelvic floor, but I'm just so entrenched in what we do as OBGYNs in our care of our patients. So that was really interesting for me. And I'll say, what is the difference between a physical therapist and an occupational therapist?
Oh, that's a good question. So generally, because it's probably more detailed than this, when I would say in the workforce, physical therapists will typically work on improving your function. Generally, we can do the full body. My OT colleagues, and this is my very basic understanding of what they do, they generally work with the upper body, so the upper extremities, but they also have training in cognitive treatment, so people who have had strokes or any kind of TBI, things like that. And I believe, and actually occupational therapists can do pelvic floor physical therapy as well. I don't know their full training, so I don't want to diminish what they do, but on a basic level, they generally work with that upper body portion as well as working with the mental health and then pelvic floor.
Okay. And then what made you decide to go into physical therapy? Like how was this something that was on your radar as something that you would want to do?
It's funny. I was in, I want to say 9th or 10th grade, and I did some volunteer experience at a hospital. And it was DC General Hospital back in the day. It's not in existence anymore. And so I did some volunteer experience there because I knew I wanted to go into the health field, but I didn't know exactly which one. So I happened to volunteer at in their rehab department at the time. And I just really enjoyed what I saw being done, helping those individuals. I think they were doing more acute care at that time, but it was just like an eye-opening thing because I had never been exposed to to physical therapy before.
So what were you doing then?
I was just literally a volunteer. So I just observed what the physical therapists were doing in the department. So I wasn't helping out with anything. It was just there. I was there to really just to fulfill my community service hours or something like that.
Keep it real.
So I think once I saw, this is a job. You could do this. You can help people learn how to walk or do things better. I was really impressed. So that's how I got initially involved with it. And then from there, just stuck with that course.
Okay. And then I think I was going to ask you what the different types of physical therapy are, but I think you kind of already touched on this in one of the previous questions. So how that relates, then I want to talk a little bit about it as like pelvic floor for obstetrical patients or pelvic floor for GYN patients, but specifically for pregnant patients. In my practice, people often come in with complaints. And I mean, I can testify to this too, as a pregnant person, that, for example, in my 3rd trimester of my first pregnancy, I remember I was so swollen. I was still working out. I lifted heavy weights, still squatting 180 plus pounds in the 3rd trimester and deadlifting and all of this stuff. I could do, and I probably shouldn't have been doing, but things that some people can still do. But I remember I just started having in the 3rd trimester back pain in my glutes or like in my butt, pain that would kind of go down my legs. So sciatica is a better description, more accurate description. I remember there was a nail place around the corner from my job, and I used to walk over there when I had enough time on my lunch break to get a pedicure, because self-care is very important. So I remember like towards the end of that pregnancy, I could it was so painful to walk, like my whole pelvis, my pubic symphysis, like my pubic bone. And, you can just have a lot of pain in pregnancy, and people just kind of go, oh, like that's normal. I expect you to have pain. You're pregnant. My 2nd pregnancy, the sciatica started in the 2nd trimester. And I remember it was during COVID, so the pandemic had started. I remember walking around like on walks with my husband, my son, and being pregnant and our dogs. And in my 3rd pregnancy, this pregnancy I'm in now, the sciatica started in the first trimester. I was like, oh, I'm pregnant. I have sciatica. I have this pain again. How and often patients will come in with those complaints, and then people just kind of write them off because they expect them to have whatever they're pregnant. Now I realize, and even then, like when I was in regular full-time practice, I would send patients to physical therapy. But when you hear that, and I can like see you responding when I talk about these things, what kinds of things do you do to help pregnant patients? And what are your general thoughts about addressing these pains in pregnancy?
So basically, when I do get an assessment for someone who's pregnant, a lot of times it's because they have some kind of ache or pain. That's usually what they come to see me for. And a lot of times that's low back pain, that's SI joint, sacroiliac joint pain. And then, you mentioned the pubic symphysis pain. Those are the three most common ones I see.
And the sacroiliac pain, like what are people complaining of when they have that?
They may just say, "Oh, my lower back hurts," and so when I do an assessment, I can kind of differentiate if it's like actually the what we call lumbar spine, or if it's actually more closer to the sacrum. So they'll like, "Oh, my butt hurts on this one side." Usually, that upper butt area is where they will start to complain of pain.
Okay.
Yep. And then hip pain too. So when I see them and I find those areas of those problem areas, generally what we will do is work on whatever the issue is that's contributing to those particular points of pain. So a lot of times, one is the body changing so rapidly. So your abdominal cavity is enlarging. So your center of gravity is off. You're walking different. If you're not as mobile, you may be getting more tighter and stiffer around the trunk area. Your joints may get a little stiffer in your low back because of that pregnancy posture where you're kind of protruded forward. And then you'll have muscle tightness a lot of times. That's your inner thigh muscles, huge area that gets really tight. And
why does that happen? Why does it get so tight?
Honestly, I think even if they weren't pregnant, a lot of people have tight adductors or inner thigh muscles. So if you weren't someone who was working on flexibility beforehand, then it's likely just gonna transition over. So
it's not gonna get better.
Not gonna get better. So it's just that that your pelvis is changing, the joints in between your pelvic bones are changing, muscles are pulling more, creating more pain, more pulling on the pubic symphysis, things like that.
Okay. So then someone comes to you for an assessment. What do you do?
So you want me to go through the whole thing?
But I mean, you don't have to go through like the whole thing, but like, for example, I'll use myself. I'm like, hey, I've been having this pain. I'm coming to see you. You're doing a consultation. So for people who've never seen a physical therapist, they don't really have a good understanding of like, okay, so what happens? What happens?
Okay. So basically, let's just say I already went through an interview process, getting information from you. I gathered all that information. So then when we get to the physical part, I'm going to look at a combination of things. I want to look at your posture. I want to look at how you just stand, how your body kind of keeps itself upright. If you're looking like you are favoring one side versus the other, or you're kind of positioning your hips a certain way, things like that. Then I'm going to look at how you walk. Same thing, just trying to get an idea of what your body likes to do when you move about. That'll give us an idea of what muscles may be working more than others, what's tight, what's weak, things like that. I generally would do like some type of squat assessment. Depending on the person, I may do a single leg assessment, but usually I don't if they're in a lot of pain. Then I'm going
What's a single leg squat? What do you mean?
I'm sorry, standing on one leg. So
okay.
Yeah.
Got it.
Just to see what, just what their pelvis likes to do, as well as maybe a little bit of balance if they're having some balance issues.
Okay.
Then I like to get my hands on some parts of the body that they're complaining about. So I'll do an assessment of their abdominal muscle tissue and fascia. Very gentle. We're not doing any deep digging into any tissues. We're just kind of gently moving that tissue of their abdomen to see how tight it is. Because a lot of times it's going to get tighter and tighter the bigger your uterus grows. So see what areas are more tight. Generally, I may find above the pubic bone and right underneath the sternum. Those are some very tight areas, and along the perimeter on the outer sides, the flank. I'm going to assess for diastasis, which I think we might hit on a little bit in a moment.
Yeah.
And going to do, for some, I'm going to do a pelvic floor assessment, especially if that's what they want to focus on. So for my pelvic floor portion, I'm going to usually have them change. They're going to be undressed from the waist down, covered with a sheet, and they'll be laying flat, and I'll assess their external genitalia. I'm going to look for any redness, swelling. When I palpate or touch, I'm going to look for any pain points, and then see how well their muscles work. So I usually want to see how well they contract, how well they relax, and then how well they can gently push out a little bit.
And how often are the pregnant patients complaining of like pelvic floor issues versus, because I think in a second we're going to talk a little bit about postpartum, and that is a big complaint that our patients have postpartum. But do you find that often pregnant patients are complaining about their pelvic floor too?
Yeah, absolutely. A lot of times, so pelvic floor PTs, we generally work with any condition that impacts your bowels, your bladder, and your sexual function. So I'll get complaints like leakage. They'll say when I cough, laugh, or sneeze, I'm leaking. They'll have sometimes constipation. We work with patients on how to eliminate better. They may also complain of pain with sex. They can't find a position of comfort, things like that. So we want to look at the muscle tissue. So I'm feeling for tightness. I'm feeling for areas that are tender to touch or sore. I'm also going to look at how well, again, with how those muscles work internally. If they have a clearance from their OB or their midwife, I'm going to do an internal muscle assessment. Not the same thing that you all do. We don't use a speculum. We just insert a finger, gloved finger into the canal and touch the muscles from the inside, feeling for those same things and looking for those same things that we look for on the outside.
I love this because every time I talk to you about something, I'm like, oh man, like this is yet another indication or something that I would refer someone to physical therapy for. So, that's why I think I'm happy that we're having this conversation, because I'm sure also some of you who are listening are like, oh man, like I could go see a physical therapist for this. Like, yes, you can. So that moves us to the postpartum patients. And so I would say most commonly the things that I send patients to postpartum is incontinence. Some incontinence we expect, or incontinence would be urine loss, so leaking urine. We expect patients to have that, or it's very, not that we expect, but it does not alarm us if you're complaining of that, like within the first few weeks after delivery, because that tends to get better. But if it doesn't get better, those are the kinds of things that we refer patients to for physical therapy, or pain with sex after delivery, sensations of like pressure or potentially prolapse. So what are some of the common things that you see postpartum patients for? And then what do you kind of recommend for those things? That's a very general topic, but I'll kind of help guide you through it if I.
That's all right. No, that's a good question. So generally what I'll see patients for postpartum, depending on their method of delivery, I may see them for C-section management, the scar management, because they may have pain with the scar at the scar location, may have numbness, things like that.
Wait, patients are going to physical therapy for that?
Yeah.
You were just, I'm just like getting more and more upset at myself at ways that I could better benefit my patients. So this is great for me. Okay, keep going, please.
Yes. I will also see patients for obviously pain with intercourse once they initiate intercourse. If they had a tear, the same thing, scar management. So trying to release the tissue that scarred down, or if they had episiotomy or any suturing, just releasing that tight tissue. Prolapse is a huge one, pelvic organ prolapse. And that's, where the structures that supported the organs, they don't have as much support. So they may sag a little bit, causing heaviness in the vagina or rectum. So we'll assess for that as well. And then if there's something related to that, we'll work on some treatment protocols for that. What else? Urinary symptoms, the leakage, you mentioned it, urinary leakage, also sometimes urinary retention as well, that they're not getting everything out.
Okay.
And then bowel management. Some people who had a really severe tear, especially if it was grade 4, we'll work with them on fecal leakage as well, and or constipation if someone had some constipation issues or fissures and things like that.
So the most common complaints that you get, what are the most common complaints that you get postpartum?
I would say the most common, probably urinary and prolapse. Urinary symptoms, so leakage, and
Okay.
prolapse. So that heavy feeling, especially when people start to do more activities and they say, oh, I want to go back to running, but I'm feeling heaviness, or I'm walking with the stroller and the baby, I'm baby carrying or baby wearing, and I'm feeling a lot of heaviness after about 30 minutes or something like that. They'll say they want to get a little bit, obviously better with that. And painful sex.
And painful sex. Yeah, I think that's something that we see patients for often. And we, give as much recommendations, but ultimately, whether you're pregnant or not pregnant, that's something that's good to see a physical therapist for. So also kind of going back to postpartum and,
I'm sorry. One more thing.
Yeah, go ahead.
Diastasis, that separation in the middle. Yeah, that's a huge one. That is a huge concern. Diastasis. People may have read about it. Really, it's people reading about it most of the time or listening to a podcast, and they get really concerned, which that makes sense. So they want to know, do I have one, and what can I do to make it better? Most of the time, people won't, think about the separation if they never heard of it before, but they basically want to improve the aesthetic of it, obviously, but also the functional part, because it can lead to back pain and things like that.
That's right. Yeah, that I can't believe that kind of escaped my mind too. But yeah, that is a common complaint that we get. And, patients will ask me or ask us as OBGYNs, and that's not something that we're trained to do. So, part of being a professional and an expert is also to know when somebody else's expert opinion would be better. And that would be a good time to go to physical therapy as well. And so with postpartum, and this is also me selfishly wanting to know, but for patients, when they're ready to start engaging in exercise, our usual recommendation is, okay, so you want to wait at least 6 weeks just to allow your body to continue to heal and to continue to adjust before you start easing your way back into activities. Some people say even longer for a C-section. And then I think ultimately people just kind of start whenever they want to start.
Yeah.
But what is your recommendation? Do you think it's good practice to consult with a physical therapist when you're ready to start engaging in exercise postpartum? Do you think, what are your thoughts on that? And if you do, when patients do consult with you, what do you usually tell them?
Sure. Actually, that's a good question too. I definitely think that seeing a physical therapist postpartum is really, really important for that reason, because you don't want to jump. A lot of times what happens is people want to jump right back into what they were doing before without leading up to it. So the same thing you would do if you hadn't been pregnant and you hadn't worked out for a long time. You don't just go back and try to do a marathon. You train for it. You kind of build up strength and endurance and flexibility. Same thing. So I would do an assessment with them and see what are the areas that may be problematic at the time of assessment, and work on improving those areas so that they can safely return to running. Running is a huge one. Safely return to, even if it's just something they do leisurely, I don't know, gardening, I don't know, whatever the case may be, just making sure that their body can tolerate prolonged periods of activity without injuring, without excessive force. The reason why that's really important too, especially with prolapse, is you don't want to put too much pressure down in the pelvis or in the abdomen if you have diastasis. And a lot of times when you lift, especially heavy lifters or run or CrossFitters, they may get accustomed to a certain way of breathing, where they're breath holding, certain way of lifting, where they are putting more pressure on different structures. So they just need a little bit of guidance on how to do those things safely. So yeah, that's what I would say would be the biggest thing.
Yeah, again, all I think of is if I ever go and start my own practice, I will definitely be hiring a physical therapist to consult all the patients, because there's so many ways. I think that it would be helpful as we just grow and change in life, whether you're pregnant or not, which brings me to my question about GYN patients. So we talked about incontinence, and that I think is probably one of the most common reasons that OBGYNs refer patients to physical therapy. But is there anything else that you can think of for patients who come in for GYN reasons, any other reasons that people see you for just GYN?
Yeah. The biggest thing is vaginismus. I see a lot of patients with vaginismus, and for those that don't know what that is, it's where the person can't receive vaginal penetration. And so it's a whole topic that I can't go into right now, but basically a lot of times the muscles are super tight. The opening is really tight, and even the deeper parts of the canal. And so it's really painful. And so that's a huge one that, I would definitely recommend OBGYNs refer for. Vulvodynia, that's painful, vulvar pain that's 3 months or more. And that's, again, a whole topic. What else? GYN related. Urinary symptoms, coughing, laughing, sneezing, urge, urinary frequency, nocturia, and what else? And urinary retention. A lot of times people kind of don't think about that, but they'll say, "Oh, I'm not able to get everything out, or I'm not emptying all the way." So if someone's having like a lot of UTIs, things like that, you may want to see if they ruled out a bacterial component, or they've done all the antibiotics and they're still having a lot of difficulty expelling their urine. I would say that might be something a physical therapist can help with from a muscular standpoint.
Yep, that sounds about right. I'm like, yeah, okay. I've referred patients to physical therapy for all of that except for urinary retention. But usually I'm either like referring to a urogynecologist who is then going to look at the referral and be like, why didn't you send them to physical therapy first? Which is, pretty much how it goes. So then before you go, because I know you are very busy, I want to leave everybody with something that they can do for something that's very common. So if I came in to you with a complaint of sciatica and you were telling me things that I could do at home, what's like a common like exercise or stretch or something that I could do to help with sciatica?
Okay. So, and I'll give this little disclaimer, this may not be appropriate for everyone. So you would have had an assessment. Your therapist would have said that this was something that they found and they wanted to use this as a part of your treatment plan. So one of the biggest stretches I give for sciatica may be a figure 4 stretch. Most people may have seen that done. It's hard to explain, but basically you're crossing one leg over the other. You can do it seated. And as you do that, you may lean forward if you're seated. If you're doing it on your back, you may be laying flat, crossing one leg over the other, and then bringing the opposite leg closer into your body. So that's going to stretch your, I'm going to say butt muscles, but we know it's the piriformis and some glutes. So essentially you're getting that stretch of the muscle that crosses over the sciatic nerve. And that can help alleviate that tension or compression component, as well as also obviously help with the pain component of that. In addition to that, we may recommend the person do some kind of self-releasing, what we call it. And they can use like a small ball to kind of roll over their butt.
Like a tennis ball or?
Tennis ball, racquetball, a firm ball that can, that won't collapse essentially. And they can roll it over the butt tissue. I'm going to say butt tissue. So that
where they're having the pain.
Yes, where they're having the pain. Gently, not forcefully. You're just rolling it over the tissue to be able to, again, release that tissue, unwind tight tissue, because essentially we want to make sure that component is not continuing to contribute to the sciatic pain.
Okay. And then you were talking about that and it made me think about something else. But one thing, and then, she and I have talked about this, but I think that this is something that's going to be very important for our pregnant patients. She also does instruction for perineal massage before you deliver to help reduce the risk of tears. And so, as OBGYNs, we know also that there is evidence that says that by doing this massage, that there are different things that you can do to decrease the likelihood that you'll have a tear in labor. And tears in labor, like, trust me, I know from personal and professional experience, can cause a lot of discomfort postpartum. So she also, as a pelvic floor physical therapist, teaches how to do a perineal massage to help, what would you say, to help release or relax?
Soften the tissue. Yeah, just soften that tissue just to make it elongated, more pliable with, like you said, the hopes of less tearing or hopefully no tearing, depending on the tissue. So essentially if I saw them before delivery, then I'm going to teach them how to start doing that. Generally, we start doing it about 35, 36 weeks or so, a few times a week. If you could do it every day, great. If you can do it 3 times a week, that's fine too. And generally just massaging over the perineal tissue. And the perineum is the space between the vaginal opening and the anal opening, and it goes from sit bone to sit bone. And I also may teach some push prep too. So how to safely push, because a lot of times people, especially if they're first time deliverers, then they may not know how to push properly. So I'll teach them pelvic floor muscle awareness to know how it feels to contract versus relax and push, so they can have that muscle excursion and hopefully prevent tearing from that aspect as well.
I love it. So I think, we went through this. My goal was just kind of to get people aware of, or further the awareness of physical therapy and all the different ways that can be helpful. Dr. Qualls, thank you so much for your time.
Absolutely. Thank you for having me.
And can you remind people just one more time where they can find you and how they can connect with you?
Absolutely. You can come to our website, www.qualitytouchpt.com. You can find us on all social media sites at Quality Touch PT. And feel free to give us a call, 301-246-2353.
All right.